Parvo disease in dogs, symptoms, treatment and prevention. Canine parvovirus, commonly known as parvo, is a highly contagious, deadly virus that generally affects young and unvaccinated puppies between 3 months and 6 months of age. However, without vaccination, this can also affect adolescent puppies and in rare cases, even adult and senior dogs. Parvo in dogs is transmitted through the body of other infected dogs or through small fecal particles from an infected dog. Although dogs cannot transmit this virus to humans, we can still carry this virus and come into contact with sensitive dogs through clothing and shoes that have been in contact with infected objects. Parvo in dogs was first identified in the early 1970s and is believed to have mutated from the feline panleukopenia virus, cat parvovirus. In India, the first reported case can be traced back to the early 1980s. There are contrary opinions about the origin of the disease in India, but experts say the probable cause was the illegal trafficking of dogs from overseas. There are 2 forms of canine parvovirus. 1. Intestinal. This is the most common form and has maximum contributed to the many outbreaks of this virus around the country. This form has the worst effect on the bone marrow and the intestines. Once activated, the virus affects the gastrointestinal tract, weakening the intestinal lining and affecting the ability of the tract to hold food and nutrients, preventing harmful bacteria from getting to the gut and preventing fluid loss. Its attack on the bone marrow reduces the white blood count in the dog and RSQUO's body, further weakening the immunity and paving the way for the virus to be more aggressive. It takes 3 to 7 days before one can observe the symptoms of parvo in puppies. The common signs of this form of parvo can be bloody diarrhea, fever, vomiting, lethargy, loss of appetite, dramatic weight loss, dehydration, inflammation around the eyes and mouth, body ache and discomfort. 2. Cardiac. This is a rare form of parvo and, as the name suggests, affects the heart. It is to be noted that in this form, parvo symptoms in dogs may not exhibit any signs of the intestinal parvovirus variant. It generally manifests in a puppy as rapid heart rate, breathing issues and attacks the heart of a young puppy, causing a random cardiac arrest. Although the symptoms may seem daunting, if the right treatment is begun on time, pups and dogs have been known to recover. What makes canine parvovirus so deadly is its longevity in hibernation. Evidence and research show that even when there are no dogs to infect, the virus can live in soil and above ground for up to a year, waiting to find a host. Checking for parvo in dogs. When you notice signs of parvo, it is imperative that the infected dog be taken immediately to a veterinarian, where tests can be performed to confirm the presence of the disease. Presence of the virus to initiate treatment. There are several different diagnostic tools used across the globe to confirm the presence of parvo in dogs, like urine tests, abdominal X-rays, electron microscopy and tissue culture. In India, the most reliable and frequently used parvo tests are the PCR, polymerase chain reaction, which has a high sensitivity rate to the virus and is the most common test for confirming the presence of parvo in puppies. The other test commonly used is the ELISA test, enzyme-linked immunosorbent assay, where stool samples are placed in a petri dish with parvo antibodies and then confirmed with a color-changing agent. The typical cost is around 1,200 Indian rupees. Parvovirus, treatment and recovery. The treatment for parvo involves supporting a dog's immune system and physically strengthening the body so that it can fight off the disease. What you must understand is that there is no direct cure or home remedies for parvo. Once the presence of the virus is confirmed in the body, the infected dog is hospitalized and kept in isolation due to the highly contagious nature of the virus. During this time, all intake of food and water is stopped. Since the stomach lining is weakened, it cannot function as it should. Feeding the dog is likely to lead to vomiting and further dehydration. Instead, intravenous fluids are given along with injections to help strengthen the dog and prevent vomiting. The average recovery time for parvo in dogs is between 5 to 10 days depending on the severity of the infection. Since the immune system is very weak during this time, it and RSQUO. It's possible the dog may pick up a secondary infection that can lead to an increase in the recovery time. Even after the body is rid of the virus, the rigorous treatment for parvo can leave your dog extremely weak and irritable. It will take another 2 to 3 weeks of a strict and nutritious diet with oodles of patience on your part to help the dog back to optimum health. About a month and a half after recovery, though it can be different for different cases, and after taking the vet and RSQUO's advice, the dog must be vaccinated to ensure total safety. What food to give to a puppy with parvo? While the virus is active in the infected puppy, no solid food is given and all required nutrition is passed to the body via intravenous drips. However, once the pup has recovered, you can introduce appropriate puppy food into the diet after consulting the vet. Parvo prevention: notify your local municipal authorities if you see newborn puppies in your area so they can vaccinate the puppies in time to prevent infection. Once again, local authorities will be required to participate in community dog breeding due to the lack of sanitation and care on the streets, and the risk of parvo in puppies is increasing exponentially. Encourage those around you to adopt and not shop. Illegal breeders will not be bound by any of these obligations. Puppies are not separated from their mothers until they have developed immunity through their mother's milk. Parvo in dogs can lie dormant under the surface for a very long time. The best way to prevent parvo is to get your dog vaccinated. Puppies should get their first dose between 6 and 8 weeks of age. They'll then need boosters every 3 weeks until they're 16 weeks old.